Acupressure points for painful period. Painful period, also known as dysmenorrhea, can be a common part of the menstrual cycle for some women. It is felt as painful muscle cramps in the abdomen, which can be either an intense spasm or a dull, constant ache. Some periods may be painful and others not so. It occurs when the muscular wall of the womb tightens and contracts as part of the womb lining shedding that occurs as part of the period. When the womb contracts, it compresses the blood vessels, triggering the pain reaction. Some medical conditions cause period pain, such as endometriosis, fibroids, and pelvic inflammatory disease. Period pain usually starts when bleeding begins, although it can start before. It usually lasts 2 to 3 days. Treatment for period pain usually involves over-the-counter painkillers. Some natural remedies involve putting a heat pad or hot water bottle wrapped in a cloth on the belly. Light circular massage on the abdomen may help relieve some tension. This video will look at some research on how acupressure has been used to help ease painful periods, and we will look at 2 acupressure points. Here I look at some research studies on the use of acupressure for period pain. One article in the American Journal of Obstetrics and Gynecology 2018 is called Effectiveness of App-Based Self-Acupressure for Women with Menstrual Pain Compared to Usual Care, a randomized pragmatic trial. In this trial, a self-acupressure smartphone app was assessed among women in Berlin in Germany. It involved 221 women between the ages of 19 and 34. Their pain levels were assessed and given a score. The women were in 2 groups, an acupressure group and a group defined as usual care. Both groups showed a reduction in pain at the 3rd and 6th menstrual cycle. However, there was a statistically significant difference in favour for the acupressure group. Additionally, participating women with menstrual pain who applied self-acupressure, supported by the smartphone app, experienced statistically significant different pain relief after 3 menstrual cycles, in comparison to women who received usual care. After 6 menstrual cycles in the intervention group, pain further decreased, resulting in a clinically relevant difference between the 2 groups. It should be noted, however, that one of the adverse reactions reported by the acupressure group was bruising, which could be caused by using too much strong pressure when massaging, so it is important not to overdo the acupressure. A second research article. In the Dover Press Journal, Patient Preference and Adherence 2012, there is a study called The Effects of Acupressure on Severity of Primary Dysmenorrhea. This study researched the effects of 2 acupressure points, the Spleen 6 point and the Spleen 8 point. 50 women aged between 18 to 30 were evaluated. In the study, it was found that the severity of dysmenorrhea pain diminished significantly for up to 2 hours following treatment at the Spleen 6 and Spleen 8 points. The San Yin Jiao Spleen 6 point is a common point used in acupressure, particularly for gynecological problems. The authors discussed that Spleen 8 was indicated by acupuncture textbooks as being effective for reducing period pain, but required more research into its effectiveness. This study found that pain scores diminished significantly and continued for up to 2 hours after acupressure. Acupressure was used for 3 menstrual cycles. Third research article. Spleen 6 is a common acupressure point used for gynecological symptoms and especially period pain. This point again was the subject of study in another research article called Effect of Acupressure at the San Yin Jiao Point on Primary Dysmenorrhea, a randomized control trial. In this trial, 86 participants were included with an acupressure group and a control group. The acupressure group applied acupressure to Spleen 6 for 30 minutes. Despite some limitations in the study, it was found that acupressure was effective in alleviating dysmenorrhea. Again, this study indicates that Spleen 6 acupressure point is a useful point for period pain. Chinese channels. In Chinese medicine, pain may be seen as a stagnation of qi or qi, also known as energy, and also a stagnation of blood and of cold in the channels. The energy channels involved in period pain are the liver channel, as it is said to store blood and regulate menstruation and ensures a smooth flow of qi. Another channel affected is the spleen channel, which in Chinese medicine is said to control the blood and the muscles. As painful periods usually involve symptoms of pain, cramping of the muscles, and is related to blood, these channels, the spleen channel and the liver channel, are clearly indicated. Spleen 6 is a powerful point in Chinese medicine. This is because it is an interception point for 3 main channels. These are the liver, spleen and kidney channels. It affects all 3 of these channels. Spleen 6, also known as San Yin Jiao, is on the medial side of the lower leg. It is approximately 1 hand breadth superior to the prominence of the medial malleolus, which is the ankle joint. It's in a depression close to the medial border of the tibia bone. So measure 1 hand breadth above the ankle joint and come back posterior to the tibia bone. And usually there's a depression which is quite tender. Feel for it, and this is where the point is. Sink your thumb and fingers into it. You can massage circular or just press your point and release, press and release. Stimulate the point for 20 seconds up to a minute. Do it on both legs in one session. Spleen 8. Spleen 8 is what is called a qi cleft point. It is used for cases where there is acute episodes of pain. They are also considered to be points where the qi gathers, which means that they may be painful to touch when affected. Spleen 8, also known as DG, is on the medial side of the lower leg. Now, to find spleen 8, it helps to find the acupressure point spleen 9 first. Spleen 9 is on the medial side of the lower leg, just below the knee joint, on the inner side of the leg. Just move your finger all the way up along the posterior border of the tibia bone, and where it comes to a stop is usually a tender point, and that's usually spleen 9. Now you want to measure 1 hand breadth down from there, again on the posterior border of the tibia, so just behind the tibia bone where it's all fleshy, and usually there's a very tender spot there, and this is usually the spleen 8 DG point. Again, just sink your thumb and fingers into it. You can massage circular or just press your point and release, press and release. So again, spleen 8 is 1 hand breadth below spleen 9, which is just below the knee joint. Stimulate the point for 20 seconds up to a minute. Do it on both legs in one session. Instructions for carrying out acupressure. Earlier I discussed one research study called Effectiveness of App-Based Self-Acupressure for Women with Menstrual Pain Compared to Usual Care, a randomized pragmatic trial. In this study, the app gives a very good set of instructions to perform acupressure. These instructions are as follows. Carrying out acupressure, find a comfortable sitting position. The right point will feel more sensitive than the surrounding area, and you may feel a slight soreness. When you have found the point, massage the area with the thumb using medium force, strong enough but not so strong that you injure yourself in small circles. Pay attention that you use circular movements and do not rub back and forth. While massaging, you should notice a distinct sensation, for example, a slight soreness, tingling, hypersensitivity or heaviness. Method. Concentrate on the points as you are massaging them. Massage the points on both sides consecutively for 1 minute each. Start the timer. Application. Begin 5 days before you get your period. Before your menstrual period, carry out the acupressure twice a day. If possible, on days when this is not possible, carry out the acupressure at least once a day. During your period, on the painful days, carry out the acupressure at least twice a day. If you like, you can repeat the acupressure up to 5 times. Conclusion. Here we have looked at 2 acupressure points, spleen 6 and spleen 8, for painful periods, and some of the research that supports this as an intervention. As with all things, see how your body responds. If something doesn't feel right, then stop. And don't overdo it. Just a few minutes a day is fine, and don't press too hard. Often, less is more.